you're curious about naturopathic medicine and naturopathic doctors, then this video is for you. Let's dive in. So even though naturopathic medicine and naturopathic doctors are probably more common than in the past, I still get a lot of people who either don't know what we do, don't know what our scope is, and are wondering if I'm a real doctor. So I wanted to answer some of those questions. So what I will say that is a bit confusing is that there are different scopes or different things that you're allowed to do as a naturopathic doctor depending on which state you're in the US and which province you're in Canada. I'm located in the state of Washington, which means that I act primarily as a primary care doctor, or have the scope and function mostly as a primary care doctor, except there are a few medications that I cannot prescribe, so things like opioids and your higher level Schedule 1 drugs. And I do not have hospital privileges or admitting privileges. Now, here in Washington, again, I am able to order lab tests. I'm able to interpret those results. I'm able to order imaging like x-rays and MRIs. In my in-person practice in Seattle, I tend to do a lot of pain management and sports medicine, so I am constantly ordering MRIs. I refer to other practitioners, I refer to surgeons, I refer to GI specialists, etc., etc. Can be responsible for screening exams, making sure you get scheduled for your colonoscopy, your mammogram. I don't do those. We don't do those in our office, but we make sure that you're on track for those. We do things like, again, I said lab tests, so looking at different blood draws. I can do a blood draw in office, etc., etc. Also prescribe different medications, so be it from pain management drugs to things like your, cholesterol medication. Now, as a naturopathic doctor, the great thing is that we also get to learn about other alternatives to those medications. So great example is, instead of your statin, I often will look at things like red yeast rice. So a supplement that actually works on a similar mechanism, the HMA co-reductase, same mechanism as your statin, but has a little different side effect profile. One of the things I love about being a naturopathic doctor is that we also get to go more in depth into nutrition, to learn a bit more about nutrition. We have a whole year's worth of nutrition in our curriculum as well. So when it comes to a lot of primary care things, at least in the state of Washington, we're pretty similar to, your traditional primary care, except I like to think we have a few additional other tools. Now, again, as I mentioned, I also do a lot of sports medicine and pain management, and I also am an acupuncturist as well. So I also do a lot of hands-on, what we call like manual therapy for things for pain. So I see a lot of back pain, knee pain, foot pain, arm pain, headaches, all that sort of thing. And I also do a number of injections as well for pain management. So anything from steroids to PRP to trigger point injections. So I like to think we have quite a bit of variety. Now, as far as our education, at least for when I attended Bastyr University, you have to already have your bachelor's degree. And of course, you need to have taken like your basic sciences. So your anatomy, your physiology, chemistry, organic chemistry, all that fun stuff. At our university, we then go on to do same basic sciences as you would if you were MD or DO. So we have anatomy and cadaver lab. You have your physiology, you have your different units of cardiology, endocrinology, etc., etc. The difference would be then when we go to do our rotation, we are not in a hospital necessarily, although we do have opportunities to do preceptor work or do go into the hospitals, again, depending on what state you're in. But you would do your clinical rotations at our clinic, which again, located in Seattle here for Bastyr, Washington campus. Oh, and one other thing I should mention about our education as a naturopathic physician or naturopathic doctor, we do take you have to graduate it from one of the few accredited colleges. There were 6, I think maybe there are 5 now. Not exactly sure on the number, across the US and Canada. And you have to pass your board exam. So we have a national board exam. And then you have to obviously get licensed in your state. You will sometimes hear people call themselves a naturopath or a doctor of naturopathy. Unless they're a naturopathic doctor who's licensed in their state, that means they did not attend an accredited university and they are not licensed to actually act as a doctor. So because each state is a little bit different, definitely make sure you're looking into this if you're looking for a provider, and make sure that you get someone who has, graduated from an accredited college, taking the national board exam, and is licensed in your state as a naturopathic doctor, or sometimes the terms differ, naturopathic physician. etc., etc. But definitely do your research on that end. I'll leave the link to our official Naturopathic Association so that you can kind of look through and find someone in your state. One of the big things that also kind of differentiates us from MDs and DOs, although this is slightly changing, is that we generally get a lot more time in office with our patients. Most of my visits are half an hour to an hour. So I get a lot of time to be able to work through a lot of the things that, diet, counseling, exercise, that generally you just don't have time to talk to your primary care about. But given that I have more time, I get to take that time and really explain things, explain why you're doing it, what the plan should actually look like versus me just handing you a prescription. And because of that, I tend to do a lot more different types of testing, so more functional testing. And this is where we start to get into things like integrative medicine or functional medicine, where lots of MDs and DOs are now kind of switching over to this model as well. So looking deeper into testing, more functional testing as we call it, as well as looking to help you supplement with different supplements or with your nutrition, working with different lifestyle changes, almost taking on the role of more of a health coach as well. And I also offer health coaching outside of my private practice, more as from the coach perspective, which is what I do inside of my program called the Better Health Blueprint. You can click on the link down in the description box if you'd like to know more about that. So I may be a little bit biased, but I think being a naturopathic doctor is great. I think we get a lot of opportunity to really help educate our patients. We do have a code then which we abide by, which one, it says that doctor as teacher. So we're there to help educate you, to help you take care of your body, because you're the expert in living in your body, and we're there. We have other knowledge, medical knowledge, and we're kind of the gatekeepers of that, but we're here to help educate you so that you can take care of yourself as well. So I should also mention that we do have sort of principles that guide us as far as naturopathic medicines, and there are 6 of those principles. Number 1 is the healing power of nature. We do believe that your body wants to be in homeostasis, your body wants to be in balance, and it's really our job to help remove the obstacles that get in the way of that. Like, your body knows how to repair itself or how to take care of itself, but generally it needs a little bit of help, and usually that comes in the form of removing some obstacles. We believe in treating the cause, so really looking for a root cause of why you have the brain fog, why you have the weight gain, why you have the fatigue, really digging as deep as we can to figure out what is the underlying reason, not just giving you a medication to help you sleep better, but figure out why is your sleep all messed up. Of course, we have first, do no harm. Obviously, that's pretty standard. We don't do anything to intentionally cause you harm. I mentioned doctor as teacher. That means our job is really to help educate. We want you to be able to take care of you, and we help to pass that knowledge on as to how to do so. Another principle is treat the whole person. So this is really where I get a lot of my reasoning behind really trying to connect mindset and trying to pull that aspect in, because a lot of times we don't connect all the pieces, or I feel like that is one of the flaws that I see in our traditional system. You go to someone specifically for knee pain, but then they don't look at your foot or the way you move or your lack of exercise. So putting all the pieces together from head to toe, including your mind and body and your spirit, is really part of the big picture. And I think one of the biggest things that's missing from our traditional system. And of course, our last principle is prevention. An ounce of prevention is better than a pound of the cure. So many times people wait to come to see me or wait to come to work with me until things have kind of blown up and everything is on fire. But had they taken this step before, or a few months sooner, or when they noticed they were starting to get a little bit stressed out and worked up and their blood pressure was kind of creeping up, it would have been a lot easier to deal with beforehand. That doesn't mean don't come in. It just means that, we really want to promote prevention in what I call real medicine, not just sick care and sick medicine. If we can get you on the right path and really help to optimize your health, going to have fewer problems down the line. Using that idea of prevention and really, again, helping you to optimize things is really my goal as a naturopathic doctor. So I hope that this was helpful. I hope that this cleared up some kind of common questions. If you have any further questions or want to share your experience about working with a naturopath, why don't you go ahead and leave it down in the description box below. Otherwise, I will see you in the next video. Bye.